Have you ever wondered how safe your routine medical procedures really are? You might be surprised to learn that approximately 1 in 1,000 patients experiences a complication from a stent placement. This procedure is considered to be relatively low risk. But what happens when something goes terribly wrong? Meet Emily Adams from California. Emily thought she was getting a simple procedure, a quick fix to keep her heart healthy. But instead of a life-saving treatment, she walked away with a nightmare that still haunts her every day. Now she's trapped in a world where every heartbeat is a reminder of what went wrong. So, what the heck happened? Let's find out. Emily's journey began with a diagnosis that many would find alarming: a severe blockage in one of her coronary arteries. Doctors recommended a percutaneous coronary intervention, PCI, a procedure designed to restore blood flow by placing a stent. Before we tell you Emily's horrifying story, do you know what a stent is? Well, stents are small, mesh tubes inserted into arteries to hold them open, especially once they have been narrowed by plaque. The machine involves placing a catheter through a blood vessel into the web page of the blockage. A balloon is then inflated to create a stent that's designed to keep the artery open and restore right blood drift. At least that's how it's supposed to work. Now let us tell you what happened with Emily. Emily's procedure, however, took a dark turn. What turned into an intended routine operation became a scientific emergency due to an error in the entire placement of the stent. The stent was dislodged and ended up in Emily's blood. The consequences of this mistake were exaggerated and probably threatened life. You might ask, how could something so terrible happen from what is supposedly a simple thing? The answer lies in a combination of things. Emily's coronary arteries were all twisted and twisted, making it difficult for doctors to know where to go. In addition, the procedure became complicated due to insufficient sedation. If you're wondering why sedation matters so much, here's the reason. If the patient is acting or stressed during the technique, this can affect the sensitive assignment of stent settings. You may be wondering what could have been done to save Emily's suffering. Isn't there a single treatment or a drug to deal with such situations? Well, unfortunately, the answer is that despite the immense development of medical science, there are none. Emily's history of previous stent placements added another layer of complexity to the procedure. So, what were the immediate consequences of this mistake? The immediate result of a misplaced stent turned into an increased threat of extreme headaches. If the stent turned out to be stuck in a coronary artery, it could have blocked blood flow, leading to a coronary heart attack. When the patient acts or is stressed during the technique, it makes it difficult to place the stent carefully. Emily's stent placement made the project even more difficult. Improper placement of the stent put Emily at excessive risk of bad outcomes. A stent stuck in a coronary artery should stop blood flow and motivate a coronary heart attack. If it went into the blood vessels of the mind, it would cause a stroke. Even in various key organs, it is able to block blood flow and cause great damage. For Emily, the stent ended up in the descending aorta. Now you might think, at least it didn't cause immediate symptoms. But this wasn't good news either. The descending aorta is a large artery that brings blood from the heart to the rest of the body. A stent in the wrong place should still be unstable here and cause problems later. After the stent dislodged there, the team moved Emily to the intensive care unit, ICU. This step has become essential for continuous monitoring and evaluation. The clinical team began a chain of immediate moves to manipulate the situation and ensure Emily's protection. They performed an imaging study that includes a CT scan of the chest, stomach, and pelvis to find the dislodged stent. Unfortunately, the scans now did not reveal the true location of the stent, leaving the team without a clear photo of its role. You may be wondering, what now? Throughout her day in the ICU, Emily's critical signs and symptoms were closely monitored. Clinical staff monitored her heart rate, blood pressure, and oxygen levels for any signs and symptoms that would indicate critical complications. Despite the high-pressure situation, Emily showed no immediate signs of distress along with chest pain or shortness of breath. It was a mitigation, but it did not obviate the need for careful management. To prevent any potential clot from forming through the misplaced stent, Emily was put on anticoagulants and various medications. This treatment regimen was essential to reduce the threat of clotting, which can cause further complications. In case you're wondering what medication she was on, Emily switched to prescribed aspirin, Brilinta, metoprolol, a statin, and lisinopril, each of which played a role in managing her heart condition and mitigating the risks associated with a malfunctioning stent. The clinical crew communicated openly with Emily about the situation. They defined the consequences of a malpositioned stent, discussed the hazards related to ability, and outlined a management plan. This transparency was important to Emily and helped her understand the seriousness of the situation and the steps being taken to address it. Clear communication also played a key role in keeping her calm during this annoying time. After days of notes that Emily remained stable and symptom-free, she was released from the ICU. She was given characteristic instructions for following recommended care and advised to look into any headache symptoms. Regular tests in the USA. They were scheduled with her healthcare provider to show her heart health and ensure that a misplaced stent would not have early consequences. Emily's Enjoy highlights the complexities and dangers associated with cardiac interventions. Although she is fortunate to have avoided intense headaches on the spot, her case underscores the importance of precise method and thorough follow-up at a given point and after scientific techniques. This event serves as a reminder that even with improvements in clinical technology, headaches can occur and vigilance is vital. In the weeks following her release, Emily attended regular follow-up appointments. These checks were necessary to monitor her coronary heart fitness and to ensure that the now malfunctioning stent would not cause any long-term problems. Fortunately, Emily remained asymptomatic and withstood her repeated care. However, the trauma of experience lingered and served as a stark reminder of the risks associated with scientific procedures. You may be wondering what could have been done to save Emily's suffering. While several elements were out of control, there are steps that can help reduce the risk of such headaches. Ensuring accurate patient sedation, careful assessment of coronary anatomy prior to the system, and use of maximal stent generation are essential to minimize risks. In addition, thorough communication between the clinical team and the patient can help control expectations and bridge any capacity issues. You may be thinking, could better communication have made a difference? Absolutely. Emily's story is a powerful example of how even small errors in communication or procedure can lead to significant consequences. It reveals the importance of careful care during medical procedures and the need for ongoing monitoring and communication. As we advance in scientific technology, we must remain vigilant and continue to improve processes to ensure the safety of those affected. While Emily's joy turned to worry, she also provided valuable guidance on the complexities of cardiac interventions. The story emphasizes the importance of accuracy, vigilance, and verbal communication in hospital treatment. With the expertise and solutions to the dangers associated with strategies like PCI, we are able to get closer to minimizing headaches and improving the effects on sufferers. While the incident was traumatic, it ultimately highlighted the resilience of those affected and the important nature of communication and care in healthcare settings. Emily's experience serves as a reminder that scientific procedures, even when performed with pleasant intentions and at an advanced age, carry inherent risks. In addition to non-public resilience, the importance of patient advocacy and assistance cannot be overlooked. Emily's story is not always an isolated incident. It reflects a wider difficulty in the medical field. Finally, online forums and support organizations have critical resources for patients with similar complications. These communities offer a platform to share stories, seek referrals, and enforce higher safety protocols. The FDA's position in reviewing draft science strategies is also critical. By honestly emphasizing the possibility of excellent outcomes, the FDA strives to ensure that patients are absolutely informed before undergoing procedures such as stent placement. This transparency is necessary to make informed decisions and to ensure that patients understand the risks and blessings of the ability. Looking ahead, Emily's case may also trigger further studies and upgrades in stent creation and procedural techniques. Constant advances in clinical technology are driven by real international reviews like Emily's. Addressing the complexities and risks associated with stent placement can result in higher outcomes and better patient protection. Emily's misplaced stent serves as a stark reminder of the pitfalls of skill in medical processes. While the improvements in era and techniques have advanced effects on the sufferer, the threat of headaches remains. Emily's experience underscores the importance of careful method, tailored care, and transparent verbal communication. For anyone considering such a course of action, it is important to carefully weigh the dangers and benefits of the ability. Take your time, do your homework, and make sure you are making a great choice in your health and well-being. Because once you get into the clinical technique, there is no lower back rotation on a regular basis. So what of Emily's agonizing pleasure? It's a reminder that clinical methods, no matter how commonplace they may seem, can carry enormous dangers. Always be informed, ask questions, and make sure you fully understand the potential effects before taking any scientific intervention. Would you like to pay more attention to stories like Emily's, or have questions about your personal approaches to fitness? Share your thoughts in the comments below. And don't forget to love this video and join our channel for more interesting content. Thanks for watching. See you next time.